I paid my rent today. It's funny how life just goes on. Oh man. Uh, it's February 1st and rent had to be paid. You go, you get your eyes stabbed, and you come back. And life goes on. Nothing stops, you know? Uh, I feel happy. I feel blessed that I'm able to be here and rest. Um, and I don't know. It's it's been tough. It's been tough. But look at me. Look, this is the eye that was operated on. Um, I can't actually see out of that eye right now. Not really. It's it's hard to describe. From that eye, like it feels like there's a black ocean on the bottom half of my vision, and the top half is like a blurry window into the world. Um, and I'm assuming that that black ocean is like the bubble that's supposed to go down. And the doctors say that it should go down within 5 to 8 days, but I don't believe them. And I don't know that I think that's what's it's really tough, um, because I think I would think that it's supposed to go down gradually, but it doesn't. Like sometimes, depending on how I'm sitting, depending on how I'm standing, it's like you know that black ocean fills my whole vision, so I don't see. Or like right now, it's just cleared up. It's like gone all the way down, and I can see a little bit. Um, so it's been a little demoralizing. Um, okay, a lot demoralizing, but I have been distracting myself quite a bit. Um, I can still like my left eye is still working pretty well, so I can still do a lot of stuff. I've been like posting and making a lot of friends, and anytime somebody messages me, I'm like, "Hi, friend. Yes, I'm here. I'll talk to you. You have questions? Yes." Yeah, because anything, anything to distract myself from what I'm seeing as I look out of this eye. Um, yeah, it's scary. It's scary. Um, but some of the people I've been talking to are people who have actually been in the trial, who are 3, 4 months in, um, and they have gone through this. And I think I was feeling so. Today's Sunday. I had my surgery on Wednesday, um, and um, Thursday was a very happy day. I think I was probably still like high on the drugs and stuff. And also on Thursday, I found out that they will cover the cataract surgery as well. Like I can just come back here and get the cataract surgery, and that made me and my wife really happy. Um, and so I was just riding that high, and then like I guess Thursday again when we came back, after they took off the eye patch, I was very happy. I was like, oh my God, that's weird. Like, what kind of technology do you have? I get stabbed in my eye and you just take off the eye patch. And like somebody could look at me right now and they wouldn't know. Well, I don't know. Like my eye could be weirdly red right now and you guys would be like, ew, what is this guy doing? Put that away, man. You know, I don't know. I can't see it. My bad. Um, but, uh, but I don't know. Like I feel normal, except for the way that I see out of that eye right now. So like on Thursday was pretty happy, was feeling pretty good. But then when I woke up on Friday, that was tough, man. Um, because I woke up and I was like, yo, I can't see out of my right eye. What have I done? You know, what am I doing? If it's supposed to go down, it doesn't seem like it's going down. Um, and like, and it's just, it's tough. You know, when I was thinking about it, I had to take a day to, kind of work through my feelings about it. Um, and it wasn't until Saturday that I kind of figured out what was going on. Um, Now with RP, um, I think especially towards the advanced stages, speaking for myself, um, the way that I learned how to deal with it is by learning how to deal with grief. Um, and that means that whenever I discover that I can't see something, I go through a process. I go through a process. Sometimes the coping mechanisms are different, but it's usually the same coping mechanisms of grief. Of, oh, fuck, I can't drive anymore. That means that this is never going to happen again. That means that I need to go through whatever it is I need to go through to deal with the fact that I can't drive anymore. Or, oh, I can't get the coffee the same way I used to. Now I need to go through the process of accepting that and, creating this new reality for myself. Um, so there's that grief, and it's a known process. So on Friday, when I realized that I can't see as well as my left eye, I was going through the grief, but also being very confused because I'm like, I think it should be joy. I think it should be joy that I'm going through, because like everybody else is going through joy. Like this, it should be joy, right? Like yes, like speaking on Friday, the day before, the doctor had told me this is a cure. This will cure you. So this what I'm seeing out of here that's making me sad and making me feel like I want to grieve. It should be joy. It should be, oh my God, this is the beginning of your journey. So there's that like confusion. There's that confusion of like, I'm grieving. I can't see, and I've set up this process in my mind for the past few years of like dealing with that grief and accepting and doing all those things. And I'm starting to do that process, for this eye. And then I stopped doing that process because I'm like, wait, this is supposed to get better. And then I try to start, being joyful. And then I'm like, and then the bubble goes up and I'm like, oh no, I can't see, so so, so Friday was a tough day. It was a tough day. It was difficult. Um, but you know what? I have a new coping mechanism, and that coping mechanism is sharing with you guys. Um, and so what I ended up doing is I just ended up again going to the Our People's Facebook group, posting and sharing, and then making a bunch of new friends. Talking and sharing about our experience. Um, and I don't know what it is about RP. I think maybe because we're getting tunnel vision, we tend to just like hide. We like hide. Like we don't talk to anybody. Like I meet so many people with RP who are just like, oh my God, other people with RP, and I'm like, everybody I meet with RP is surprised that there's somebody else with RP. Like we need to stop hiding. Um, so and it helps when we do because then when I'm able to share with other people, then they're able to at least talk and relate, and that helps a lot. So through Friday, that helped a lot. Um, yeah. So I don't know. Um, I just I'm in a much better place now. Like especially now that I'm talking through it, I'm in a much better place. Um, like I woke up this morning. I was woken up this morning very rudely by my phone ringing. because the vet that we had sent my dog to, we had sent my dog to stay over at the vet for about 2 days so that they can check on him, and then we return him back to the house sitter. I care about my dog. And like they had checked on him, and they uh, life goes on, man. You know, like there's just stuff you still have to take care of. But anyway, they're calling and they're like, "Oh, we want to return him. Please, please like let your house sitter know so that we can return him and all the stuff." So I gotta wake up and I gotta like call them back and be and like coordinate with the house sitter and all this stuff. So I can't just you can't just sit here and just be like, oh, my vision's being healed and, I can't do anything else. My wife's asleep. Like I still got to do stuff. And it's February 1st, so I got to pay rent. So I guess in a way that also does help because um, that helps, and it did help me also get out of that funk because um, I had to think about it, and I had to be like, life does go on, regardless of how this turns out. It does go on. If it turns out that this treatment makes me fully and totally blind, I was going to be fully and totally blind anyway. And was I just going to stop living? No. like, no. I'm not that type. I got shit to do. I got stuff to do. I really do. I'm busy, man. Like I want to do stuff. If I can't see it, fine. But I want to do things. Right? Like take me on a roller coaster. Cool. Like I don't have to see it. Some people go on roller coasters while blind. Like it's cool. I'll figure it out. So I had to remind myself of that, quite a bit. And when I came into this, it was with the knowledge, again, what do I have to lose? My sight? I'm already losing my sight. Um, so that means that anytime I'm doing these things, I have to remember that there's life outside of this. I have to remember that there's a dog I have to take care of. I have to remember that I do have rent to pay. I have to remember that I will need a career. I will need to continue making a living after this. I have to remember that groceries have to be gotten. My wife just bought groceries yesterday, and I had to sit down with her and do the grocery planning while I'm looking out of this. Like, that's, man. Man. but uh but I'm working through it. Um I'm working through it. And I think it helps in a way because continue. Um you continue. And I think the other thing I was trying to work through is that I feel blessed and I feel happy that we're able to do this because this is a big thing, right? Um Especially if and the doctors believe this. I'm having a hard time believing it because of what I'm seeing out of my eye right now. You know, um, but I have to remind myself of what's been happening and what everybody else is saying and what the science is. The doctors believe this is the cure we've been waiting for, and if this is the cure that we've been waiting for, the cure to blindness, um, we should give ourselves the space to be able to just sit and let it happen. Like that should, like I think that's why I'm struggling a little bit with it. Is I feel like life should stop. you know, like I feel like this is amazing. I feel like this is a miracle. So life should just stop for a while. You know, um, like like you should be able to take a month off and just be like, you know what? I was losing my sight for my whole life, and now for a month, nothing. Um, so I'm doing my best to kind of make that happen, but life is still life. Life is still happening. Um, I don't know. My mind is kind of all over the place. It's probably because mm, I can't see out of this eye, man. um, but okay. I think I think if there's one thing I'll say about this time period, um, is that immediately after your surgery, it will be tough, um, and you will question why you're doing it. Um, but I have, like I mentioned before, I've spoken to a few people who have gone through it, and despite what the doctor says that it will take 5 to 8 days for this bubble to go down, it's taken about 2 weeks for them for it to go down, and after that, then I think one of them said it took a total of 4 weeks before they got back to their baseline. I wasn't even expecting that I would get back to my baseline that quickly. So I think that's a reasonable expectation. Accept that reasonable expectation for yourself. And I think part of the grieving I was doing is I was realizing, wow, like if I do this surgery in 2 weeks' time, I'm actually not going to be able to see at all. I won't be able to use the phone, like properly. I won't be able to do any of those things. And I was panicking a little bit. Um, and I think it's that reality of like, I'm going to be fully and totally blind, and now I have to work through those feelings of, of what that entails, as well as then figuring out how I'm going to live my life then. Um, so that was part of the post I was putting on the RP group is, hey, how am I going to figure out how to do this? Um, and, some of the things that helped a little bit is that I was like, okay, you know what? I've got 2 weeks. I can figure something out, right? What are the things I want to do? Do I want to start using the phone? What do I want to use the phone to do? To text? Okay, let me ask some few people, who are fully and totally blind, how they use the phone. Then, I went and I activated Android Talkback, and I trained myself a little bit. And I'm actually going to be working on that over the next few days. It's just, working on the Talkback. And like because I can still see a little bit, it's easier to train myself to do it. And it's also really interesting because it's giving me insight into some of my blind community as well in terms of what they use and how they do it and how they deal with it. And I can actually help a few people in terms of that. So, so that's been nice. Um, and that's also been a good way for me to remind myself of what I'm doing, and remind myself that this is kind of funny, right? I feel like okay, we're going to speak this into existence. This is a cure, all right? Um, and since it is, it's kind of a funny process that it will make you get worse. It will accelerate you to the point where you should, where you would have been before it even starts to come back. Um, and and I think that grief was accelerating for me, where I was like, oh crap, I cannot see out of that eye. And now I'm trying to work myself back, and that don't worry, it's going to come back before it even comes back. So it's just working on that faith for it to come back. Um, and yeah, and I think that's probably the journey that it would have to be because the way the surgery works is he actually goes in and he removes all of your dead cells first, like removes it, all of them. So it clears out, any of the debris, so that they can grow back. After he removes all of them, then he goes and applies the drug to the remaining healthy cells, so that he teaches those healthy cells how to produce more healthy cells. And from those healthy cells, once they take up the drug and they take up the instructions on how to grow the photoreceptors properly, then they go around and grow the photoreceptors where the dead cells were. Um, so this means that I think when he removed it, this is just conjecture, I don't know, but I think when he removed, some of the other ones, it kind of, I don't know, I'm thinking it kind of, accelerated it. Mm. Um, and, if that's the case, then it's like, yeah, I, I just have to wait and trust that it will grow back, you know. And that's the hard part. That's the hard part. Um, but it's been what, Thursday, Friday, Saturday. So it's been 4 days. 4 days. I shouldn't be whining, bro. It's been 4 days. They said 5 to 8 days. It's been 4 days. I'm sitting here. I'm like, oh my god. I can see out of this eye, but I can kind of. I can see. I can see a little bit. Um, so this is a mental game. This is a mental game, and it's tough. And I think I don't know. Just remember that it's tough and work through it. Find ways find ways to deal with it. I will say though, if you're going through this and if you're watching and planning to go through the treatment, um, I will say prepare to be fully and totally blind. Prepare for it. Um, if you, I think some of the other patients who did this before are further along than me. So some of them have a lot more preparation. Some of them already know how to use talkback. Some of them already do that. So maybe they didn't go through as drastic a change as I did. Some of the people I talked to on the phone, a lot of this is not surprising to them, but they were able to support me because they've gone through it. So I'll say if you're I guess coming from something closer to where I'm at, where there's a lot of usable vision, you haven't, utilized JAWS, you haven't utilized voiceover or talkback or anything like that. Before you come to this treatment, please prepare to do that. Um, I think I thought I was going to prepare to do that, but I wasn't fully mentally believing it. Um, and I think the past 3 days have been tough for me because I was like, oh, no, I will need to do this. Because I literally can't walk downstairs right now without grabbing my wife's shoulder. I have to feel around to find anything, and that's just one eye, dude. Um, I can barely do anything. you know? So if you can, do prepare. Like, take this seriously. It is a serious thing. Like, you're curing blindness. Take it seriously. Don't think you'll come and then just go right back to work. Don't do that. Um, so I'm working through that. I'm working through that. But you know what? This is amazing, dude. Like, do I look like I don't know. I can't wait to watch this back when like I can see cuz anyway, man, I don't know. Those are my ramblings. Um yeah, I think I'll just stop it there. Bye.